Hello, everyone. Today's unit, we are going to be discussing both eating disorders and another concept associated with eating disorders, which is known as RED-S, or Relative Energy Deficiency Syndrome. So kind of to get us started, and again, looking at applying this to sport nutrition and to how it might affect our athletes, why are athletes concerned about weight loss, or why are athletes interested in weight loss? And again, the purpose for this part of the conversation is for us to kind of get a feel for how eating disorders might come about. However, we'll spend some more time later in this course talking in more detail about how we can facilitate weight loss for our athletes. But in general, when we think about athletics and why athletes are concerned with weight loss, we can think about this ratio between weight and power production. So essentially, especially for sports that require locomotion. So again, any sport where I have to manipulate or move my body with any amount of speed or force, the less weight I have or the less mass I have, the more efficient I can move, right? So again, if I can eliminate the amount of fat that I have in my body, that would allow me to enhance my performance theoretically from that particular standpoint. Let's see. Again, other reasons why athletes might be concerned about weight loss, there's a lot of stigmas associated with, looking a certain way for athletics. So when we think about some of those aesthetic sports such as diving or gymnastics where you're being judged. Again, a lot of those athletes might feel pressure to also be a certain weight as well. Not to mention, our sports where they have to weigh in. So again, we think about weight classification sports. Certainly weight loss is an important component of their sport as we think about cutting weight. And again, the idea with that is really maximizing the quality of weight that I have so that I can really enhance the likelihood of performing better than others that maybe haven't maximized the quality of weight that they have. So again, we think about general weight loss strategies for athletes. It's recommended by ACSM, which is the American College of Sports Medicine, and AHA, which is the American Heart Association, that individuals need to be doing a minimum amount of physical activity in order to gain general health, but can also assist us with weight loss as well. So again, we need to be doing 30 minutes moderate aerobic exercise 5 days a week, or 20 minutes vigorous exercise 3 days a week, or some sort of combination of those two factors. And then at least 2 days of strength training per week as well, a minimum 30 minutes per session. Again, those are kind of the bare minimums when we think about weight loss recommendations. From a physical activity standpoint, that's pretty easy for our athletes to be able to meet those guidelines. Okay, so in order for us to enhance the probability that our athletes are losing weight, they're going to need to do more than that. Okay, so again, 30 minutes is kind of just this general what I need to do to maintain general health. However, in order for us to lose weight, we need to burn more calories than that in order to establish this calorie deficit. So ACSM recommends that individuals do between 60 to 90 minutes of aerobic exercise 5 days a week. Again, athletes are generally not having any problems getting in the required exercise. So when we think about weight loss, now we need to consider this balance between calories in and calories out. Okay, so again, if our athletes are expending plenty of calories, then we really need to focus on what's going in, right? So modifying calorie intake as opposed to having them do more exercise. So weight loss goals for athletes or for general population, 5 to 10% of our current body weight over 3 to 6 months. So again, if I am 150 pounds, we're looking at maybe 15 pounds of weight loss over a 3 to 6 month period. We don't want to exceed 2 pounds of weight loss per week. And again, the reason for that is we want to gradually modify someone's set point. And again, we'll talk more about that when we get to our weight management unit. But set point is basically, the range in which your body wants to be as it relates to weight. And if I can gradually modify that, it increases the likelihood that weight modification will become more permanent. Okay, so gradual weight loss tends to be better when we think about, maintenance in the long run. Okay. So again, we think about some of these weight loss goals. They should be based off of BMI for non-athletes. That seems to be a fair or a reasonable way for us to monitor the weight change. So BMI is basically body mass index. So looking at the ratio of weight to height for an individual. Again, that seems to be good for non-athletes. For people that exercise regularly, body fat percentage would be a better option. So again, instead of looking at losing a certain amount of pounds, we should be focused more on making sure the weight that we have is quality. So looking at trying to lose body fat percentage as opposed to just simply losing weight. Okay. We can monitor weight weekly. Some people monitor their weight every day. Some individuals once a week. It really depends on, there's certainly some psychological factors to consider when we think about what's appropriate for an individual in terms of how often they're weighing themselves. We can also monitor body fat percentage every 4 to 8 weeks. 8 weeks is going to be better just because of the standard error level when measuring body fat percentage. Can be anywhere from 2 to 6% level of error. So again, if I'm seeing maybe like a 3% decrease in body fat percentage over that amount of time, we don't want to see this change that's only related to the error level as opposed to actual change. So 8 weeks is appropriate in regards to rechecking somebody's body fat percentage. Okay. As I kind of already mentioned, weight classification sports such as wrestling, rowing would be another example. They are generally at higher risk for weight loss measures that are unhealthy, so they might use rapid weight loss measures that can be detrimental to their health. Some of the major issues associated with cutting weight, we see a lot of dehydration, electrolyte imbalance, because again, when I'm trying to cut 5 or 8 pounds in just a few days, what I'm losing is primarily going to be water weight. Okay. So again, we'll see dehydration, and when we start to lose some of the fluids within the body, that can also lead to an electrolyte imbalance. Because our blood becomes more viscous in nature, that can cause us to decrease our cardiovascular function. Okay, so what I mean by that is basically as I start to lose fluid from my body, that's going to cause, let's see how this little marker thingy works, a decrease in cardiovascular function, because as I lose fluid, the blood becomes thicker. Okay, so imagine your heart trying to pump water versus a milkshake. Okay, so the pumping of the milkshake, which is more viscous blood, or the blood is thicker, causes more strain on the heart. So that can cause a decrease in cardiovascular function for us, because it's basically putting more stress on the heart to do the same amount of work that it was doing before when I wasn't dehydrated. It can also affect renal function. Again, when we talk about renal function, we're talking about the function of the kidneys. And the kidney's job is to filter out the blood. And if the blood becomes too thick, that can become an issue with us in regards to the effectiveness of the filtering system. Thermoregulation is another major concern for us with dehydration. Again, that's the major threat with kind of these weight cutting strategies. So thermoregulation, what role does fluid have with thermoregulation? Well, the more fluid that we have in our bodies, the easier it is for us to dissipate heat via sweat, so we can sweat more. Also, we do a lot of thermoregulation within the cardiovascular system as well. So one of the things we can do is we can move blood to the skin surface. So again, if any of you out there get like flushed cheeks when you exercise, that's because you have more blood flow at the surface of the skin, and that's going to allow us to dissipate heat that way. Okay. As I get dehydrated, again, it becomes more difficult excuse me, for us to complete thermoregulation appropriately, because I don't have enough blood to send to that skin surface like we just mentioned. Okay. Hypoglycemia, so I have a decrease in sugar levels within the blood. That can become a major issue for us as it relates to our ability to produce a large amount of force. So that can certainly be an issue, and also fuel the brain as well. Okay, which might lead us to an inability to focus from a mental standpoint. Also can cause us to feel very fatigued, worn down, and a decrease in stamina because of that decrease in sugars available. Okay. So what happens when these weight loss efforts develop into eating disorders? Okay. So again, this is a common concern for both athletes and non-athletes. It is more common in sports where there's subjective scoring, like we mentioned, diving and gymnastics would be two examples of sports where you've got kind of the subjective scoring element to it. And also in sports where being small is an advantage. Okay, so something like endurance running, for example, the smaller I am, the less weight I have to move over an extended distance. And so therefore, being small is more efficient for us in the long run as it relates to performance. Okay. So our statistics show that about 13.5% of athletes have had an eating disorder at some point in their lives, and about 4.3% in the normal population. So we are seeing a larger prevalence of eating disorders in an athletic setting in comparison to just the average population. So what are some of the common traits that we're looking for when we, are curious or concerned about an eating disorder? These types of people generally have high expectations. So they've got this, very type A personality. So they are very organized. They expect a lot of themselves. They're maybe perfectionists. Maybe they're very competitive in nature. So again, maybe it's not so much about this confidence issue. It's more about, well, I know if I'm smaller, I can perform better, and that's what I want to do. I want to be very good at my sport. So that can certainly be a trait to look out for. Compulsiveness is another trait. And again, we see this more in our bulimic individuals in comparison to the anorexic individuals. But compulsiveness, so a bulimic person might eat like a large pizza just on a whim, and then they feel like they need to go exercise, run 10 miles or something like that to kind of make up for that full pizza that they ate. Somebody that is anorexic is not compulsive. They are very planned in everything that they do. Okay, very, very organized, like I said, as it relates to how they can like trick people into not knowing that they have an issue, and B, into planning exactly how many calories they're going to eat and how much exercise they can do in order to kind of take care of those urges, basically. Okay. They're very driven. Again, I would say that's going to be true in both your anorexics and bulimics, but again, they're very driven to be successful, particularly in their sport if we're thinking about this as it relates to our athletes. Often, but not always, often they're going to have distorted body image. Okay, so they think they're fat, but they're not, basically, is usually how that works, right? Or they think they're way bigger than everyone else, even though they're the same size as their teammates, and those types of things, right? They've got a preoccupation with weight and dieting, so they have a lot of anxiety and negative emotion associated with food and eating. Maybe being in a large group and sitting like at a large table and eating could be very stressful for this type of person. And again, this preoccupation with their kind of their weight and food and those types of things might stem from their desire to kind of hide their issue. Okay, so they might get a large plate full of food. In particular, they might grab, like, if they're in the cafeteria, they might get like a large salad with a bunch of different vegetables and that sort of thing, but really not a lot of calories, right? And instead of really eating a lot of that, they might just be able to kind of move it around with their fork a little bit, right? So they can kind of manipulate their plate so it looks like they ate something or ate some, when in reality they haven't really eaten a whole lot. Okay, so they can be very, I don't want to say tricky, but they can be very tricky as it relates to kind of hiding their issues. They can become very good at that, hiding these issues from their teammates, from their friends, from their roommates, and those types of things. Okay. They have a tendency towards depression, and again, that could be related to this kind of lack of self-confidence and also this distorted body image. So they might, have some tendencies to have depression or have, depressive types of thoughts. Okay. So some of the symptoms that we see associated with eating disorders, certainly they will experience some weight loss. And again, I have listed significant weight loss. Some of them might just be super, super real skinny and just stay that way. So that's another option. And instead of significant weight loss, they just might stay very thin once they're to a certain point. Like I said, they're certainly going to have a preoccupation with both food and their body weight. They might weigh themselves 6 times a day. Okay. And they might have every single meal planned out to a T as it relates to how many calories they're able to consume. They're also very educated on nutrition. So they take it upon themselves to know the calorie content of literally everything. And again, they can be very manipulative. I don't think is the right word. Deceptive, that's the word I want to use, as it relates to getting people to think that they're eating a lot or plenty when they're not doing those things. Okay. Again, distorted body image. They've got an increased criticism of their own body. They try to eat alone. So they try to isolate themselves so that, they cannot eat much and they don't have to worry about somebody judging them or saying something like that. Again, bulimics are going to eat alone a lot because they're going to binge. So they're going to eat a ton of food. And again, then they're going to feel super guilty about that. So those are some of the traits that we might see in bulimics. Use of laxatives, again, we'll see that in the bulimic population as well. Like I said, they might eat a large meal and then they're going to use laxatives as a way to kind of get rid of those calories or that weight that they might have gained associated with that one meal. Okay. They're going to have compulsive or excessive exercise habits. Okay. So compulsive exercise habits, again, I ate a large meal and so now I feel like I know it was 1,200 calories and I know that in order for me to burn 1,200 calories, I need to ride my bike moderately for 2 hours. Okay. So I'm going to do that same day. So let's say I ate this big meal at dinner time. Okay, well, I might wait until 7 p.m. or whatever, and then from 7 till 9, I'm going to ride my bike that night in order to get rid of those calories. Okay, excessive exercise. Again, the tricky part with excessive exercise is it can kind of be masked by dedication to sport. We live in a society where in general, more is better when we want to be successful. And if we're dedicated to our sport, yeah, we might be doing 2 workouts a day or more than that. Okay. So excessive exercise can often be kind of covered up by maybe this passion or this desire to do well in their sport. So sometimes that can go unnoticed. I think the time that excessive exercise becomes really a major concern or very clear is when this type of athlete becomes injured and they are so, wrapped up in what's going on and this kind of maintenance of body that they're willing to continue to exercise even though they're injured. Okay, so they're still going out and they're still doing things when maybe it's making their injury worse, but they just don't know how to stop. So it becomes very evident in those types of situations that they have an issue with exercise as well. And then complaining of always feeling cold, again, that's another common symptom just because these individuals have a low body fat percentage, and so that can be an issue for them at that point. So again, when we think about some of these characteristics that we see in individuals that are experiencing eating disorders, generally speaking, the most common cohort would be females, the age 12 to 25 years of age, generally going to be middle and upper class families, and it seems to be equal across all ethnic and racial groups. With these statistics being fairly relevant, we have seen an increase in eating disorders in males in the past approximately 10 years as well. So again, we can kind of classify these eating disorders in a variety of ways. One of these would include bulimia nervosa, which is characterized by some sort of binging followed by some sort of purging. Again, binging generally will involve consuming a large amount of calories in a short amount of time, very compulsive in nature. So again, these individuals weren't planning on doing this. They just feel kind of out of control and they can't stop themselves. Maybe they kind of starve themselves for all day, for example, and then it gets to like 9 p.m. and they just eat and eat and eat, or something along those lines. Or maybe, they're eating really, really healthy, not many calories, and then they, maybe start drinking that night and then end up binging on some sort of food like, pizza or some sort of junk food, something along those lines. The purging methods, again, traditionally, a lot of people think this has to be throwing up, but it can involve many other options as well. When we think about purging, what they're trying to do is get rid of those calories. They feel extremely guilty about what they just did, and so they're trying to get rid of those calories. So it could be throwing up. It could also be diuretics and laxatives, maybe some sort of combination of those things, and certainly excessive exercise as well. So again, I ate this large pizza and I know it's 1,200 calories. Well, I know if I go, run 12 miles, that'll kind of balance that out, or I can ride my bike for 2 hours or whatever. Again, individuals that have this disorder are very, very educated on calories, whether it's how many calories they can find in any nutritional item. They're also very educated on how many calories they can burn while doing the elliptical or while running, or, those types of activities that they might be using to kind of purge themselves following one of these episodes. Okay. Anorexia. One thing else to note when we talk about bulimia, a lot of times those individuals are of average size. So again, they're not going to look super thin because they're just kind of still balancing their calories. So again, they might be a little bit thin, but they're not going to be, as thin as what we would see with someone who's anorexic. Somebody who is bulimic, they're trying to get thin. That's one of their goals a lot of times, but really they're just kind of balancing those calories at the end of the day. So they have those big binges and then they try to balance that out with some sort of version of purging. And so again, a lot of times they're not extremely skinny, so they kind of blend in that regard. Again, I would say a lot of times those binges are going to occur on their own. So they're going to be very secretive about that. So their roommates aren't going to be aware of it, or their friends, or their parents for that matter. Those binges can occur kind of by themselves, and certainly the purges can occur kind of in privacy as well. With anorexia, again, a lot of times we can see this in people. So these people are extremely thin. They have an intense fear of weight gain. They'll avoid food at all costs. They'll use different tricks to kind of make it seem like they're eating food, but they're not necessarily eating a whole lot. They have an extremely distorted body image, just as in this image here, you can see that the girl is very, very thin, but she views herself as kind of like an average body weight. Okay, so they've got this distorted body image. It's a clinical condition. Again, it can be manifested by extreme fear of becoming obese. Really, when we get down to the root of a lot of these eating disorders, a lot of times it's rooted in control. Okay, so it's not necessarily about food, and it's not necessarily about nutrition. So here at Loris, I teach sports nutrition for undergrad students. I also teach our intro to nutrition class, and then obviously I'm teaching this graduate level sport nutrition class. So I've got a pretty in-depth background in nutrition, and as an endurance coach, I've worked with lots of athletes when it comes to some of these issues. And even it's kind of interesting to me because like our counselors here at Loris, when they see a female that has an eating disorder, or they suspect that they have an eating disorder and they're an athlete, they almost always ask if I will meet with that particular student athlete. And again, there's this common misconception that what the issue is nutrition, and that if I can get them to just eat more calories, then that's going to solve the problem. But in reality, this is more of a psychological issue. And like I said, it's a lot of times it's about control. So maybe this person feels like their parents are very controlling, and the only thing they can control is what their body looks like. Okay, so that might be part of it. So maybe they're in some sort of relationship or something else going on in their personal life where they feel like they can't control what's going on. And so this is the only type of control that they have. And again, I see that very, very commonly with both anorexic and bulimia within a lot of athletes that I've personally worked with. So this condition, again, we talk about athletics. Wow, this is certainly a major factor that I've seen a lot of in my, I guess, 12 years or so of working with athletes. Anorexia athletica. So this is kind of a subclinical condition when the individual is going to practice inappropriate eating behaviors and weight control methods to prevent weight gain or increases in fat. So again, when we think about, how do I clinically define or diagnose somebody with an eating disorder, anorexia athletica, it's all on a continuum, right? Do we have a unhealthy relationship with food and with exercise? Do we have negative emotions or feel stress when we're around food, or we feel anxious because of those things, right? So again, we think of anorexia athletica as kind of like the beginning stages of an issue. So again, I want to kind of control what I look like, and maybe that's not necessarily because I'm concerned about body image, but I'm really concerned with athletic performance. Again, there's a healthy way to try to lose some weight so that you can be more successful in your sport, sure. But we've got to really be careful about that, and in terms of taking it too far and letting it really consume that particular athlete. So again, I would say this is on the continuum. And when we think about this particular type of person, yes, they're very educated on calories in, they're very educated on how many calories they're burning. They're interested in a lot of those factors. Maybe they're interested in supplements or something along those lines. And again, that interest is great. Like, I want to promote health and fitness, absolutely. But we've got to be careful in regards to how, that might progress into something more. So again, what are some characteristics that we might see in this kind of subset? So this particular person might decrease their calorie intake. So again, they might start cutting calories a little bit. They might see a decrease in their body weight. They might have a desire to lose weight. Again, this could be based on their dedication to the sport. So they're driven by athletic performance, or it could be based on perceived performance. So this person might think like, gosh, if I could just lose 10 pounds, I'd be so much faster. I'd be so much better at XYZ sport, right? So again, some of it is perceived and some of it might really be true. I mean, if you do lose weight, yeah, it can help you in a variety of sports. However, there's this thin line between, losing quality weight that would actually decrease your performance. Weight cycling based on training levels. Again, it's probably okay to have a little bit of weight cycling. So again, your weight during your competition season or during the in season might be a little lower or higher, depending on the sport, depending on the individual. So that's okay a little bit, but we don't really want to have like a 20-pound swing when they're in season. We certainly don't want to promote weight loss during season, with the exception of, sports like wrestling or something like that where we're cutting weight. The rest of us should probably try to be of quality body mass at the beginning of the season, so that way we can focus on the skills we need to focus on during our sports practices, and focus on having the adequate amount of energy that we need to really maximize our performance. And then lastly, another characteristic, our view of self-worth by athletic ability and performance. I with working with various athletes, a lot of us think like, oh, I have a good self-confidence, and I've got my head on straight and that sort of thing. But I think when this really shines, it's we can really see this become an issue is when an athlete gets injured. And now you take away this part of their life that is really, really important to them and really defines them. Okay, so if this athlete, they don't even know that they're doing it, and now you take away this part of them, right? Well, I'm a basketball player, and so if I don't play basketball, then who am I? So again, if I'm not performing well or I can't perform because I'm injured, then how does that kind of self-confidence change, in that given situation? So again, that's another factor to kind of keep in mind. I've seen athletes kind of have these issues flare up when they are injured. They don't know how to funnel their energy when they can't practice and they can't compete. And so, their self-confidence and their self-concept of, who they are can really be, modified by, various environmental situations. What about borderline eating disorders? Again, it's hard to say yes, no to some people. We're kind of all on this continuum. We might have some symptoms of eating disorders. Honestly, like, you eat a big meal or something, then I feel like, wow, I should probably run a little bit extra tomorrow, So does that mean that I have an eating disorder? Probably not. But is that a symptom that maybe could lead to something? Maybe, right? So again, it's important for us to kind of pay attention to some of those habits. Experts feel that the majority of Americans, and particularly women, have at least some unhealthy attitudes or negative emotions associated with food and self-image. Again, if you're working with females, really one of the greatest things you can do for them, and for the males as well. I coach males as well, so I can say that's important for them too, is building self-confidence. If you can do anything for an athlete, if you can give them the confidence they need to go after their goals, whatever that is, wow, you've done them a great service. So, I think a lot of that comes into play here really in this slide. We think about self-image, and if I can build confidence in athletes, wow, that is huge. So the next thing that I want to talk about is something known as the female athlete triad. Also, now it's been called the Red S, or relative energy deficiency syndrome. And I've got this little YouTube video, so I would encourage you to kind of click on that link and watch that on your own. That gives you some statistics about awareness of the female athlete triad. But again, what does this disorder include? Tri means three, so it's got three components. Number one is energy deficiency. So essentially what we're looking at here is calories in versus calories out. Okay, so I'm not matching my calorie intake with how many calories I'm expending. So I'm expending significantly more calories than that which I'm bringing in. Okay, menstrual disturbance can be a consequence of this issue as it relates to energy intake. And menstrual disturbance can include one of two things. And I have these kind of spelled out in a future slide, so you can get the spellings of these because they're a little bit tricky. One is amenorrhea, which is the complete loss of the menstrual cycle. And the other option is oligomenorrhea. And with that, it's like a more sporadic menstrual cycle. So they're only getting like 3 to 6 menstrual cycles per year, when standard, we expect individuals to have 10 to 13 menstrual cycles per year. Approximately one every month is normal. Okay. So again, this menstrual disturbance can occur as it relates to an energy deficiency. And again, the reason for that is, you're not giving your body enough calories, and you're expecting your body to be able to perform a significant amount of work or stress with your exercise training. And so as a result, your body chooses to shut off reproduction because reproduction is not an essential part for an individual to be able to complete in order to survive, right? So when we think about our species as a whole, yes, we need to have reproduction, but each individual person, it's not necessary for that individual person to contribute to reproduction in order for our species to survive as a whole. Okay, so that's an easy system for our body to say, you know what, no, I don't have enough energy to do that system, so I'm going to shut that down or make it less regular, less common, basically. Okay. And then the last component when we look at the female athlete triad is low bone mass, or bone mineral density can be negatively impacted. And there's a relationship here, and again, I'll show you a little bit more detail in these upcoming slides. There's a relationship here between estrogen, which is a hormone that I'm going to release during menstrual cycle, and estrogen plays an important role for females as it relates to the storage of calcium in their bones. Okay, so if I slow down or decrease the amount of estrogen that I release in the menstrual cycle, that can also reduce the amount of calcium that I store within my bones, which will mean that my bones are going to become weaker. So again, when we think about this red S or this female athlete triad, again, which athletes are at greatest risk for developing these particular issues, we find this common in gymnastics, figure skating, wrestling, distance runners, dancers, competitive divers, cyclists, really any sport where they might have weigh-ins or being small is an advantage for them. Again, also some of those aesthetically important sports such as diving or gymnastics, and certainly sports where we have to wear tight clothing such as swimming or even running, for example. A lot of times we'll see these issues in those particular athletes. So again, I want to take a moment to kind of touch base about what's happening with the menstrual cycle and why this is important for this particular issue. Okay, so again, this kind of shows you what's going on. Let me get my little pointer here. What's going on throughout 1 month's period as we look at the changes within the menstrual cycle. So here you can see what's happening with the ovaries, and with the ovaries, essentially each month a female will select and mature one single egg, and as the egg matures during this follicular phase of the menstrual cycle, it will then be released from the ovary for ovulation, and then once ovulation has occurred, that egg will travel through the fallopian tubes, where it can either become fertilized or it will eventually degenerate and be secreted with the menstrual cycle. Okay. Again, some other changes that we see body temperature changes throughout the month, and in particular of importance here is the luteal phase. We see an increase in body temperature in the average female. This can be not quite a degree. It's about a half a degree Celsius in regards to the change that we see when comparing the follicular phase and the luteal phase. Okay. Of greatest importance to our conversation here is what's going on in the endocrine system, or what happens with the hormones. Okay. And two hormones of great importance to us here are the estradiol or estrogen, and also progesterone. Okay. And these two hormones are important in order to maintain a regular cycle. And you'll notice that if we were to keep this pretty basic, estrogen is going to peak during the follicular phase, and that's going to stimulate the release of the egg during ovulation. And then during the luteal phase, we see progesterone really increasing, and that's going to help prepare the uterine lining in order for us to have the potential to implant that egg at that particular time, which would allow us to have a successful pregnancy. Okay. When we look at what's going on with the endometrium, and again, this is the location where the egg might implant if fertilization does occur, the first couple days of the menstrual cycle are menses, or when a female bleeds, basically. So that can last on average between 4 to 7 days in duration, and then we spend the rest of the month kind of preparing for the potential of that egg to implant. So basically we build up this lining, and it's going to become thick with capillaries, which are going to allow us to provide blood to the potential egg and nutrients. There's also a bunch of carbohydrates in this particular area, and again, that would allow us to kind of fuel the egg if the egg does become implanted. So again, things that are important to us as it relates to the female athlete triad. Essentially, what will happen as I become more trained, or overtrained or I'm not giving myself enough calories, is I'm going to see a decrease in estrogen release. Okay, so again, we think about what is a normal level of estrogen for a female. It can vary pretty substantially from one individual to another individual. However, we do know that relative to kind of where you started out, estrogen levels will decrease. So instead of having your curve kind of go up here like we have in blue, let me add a yellow curve here. That's what'll let me. If I add yellow here, instead of going up like it does in blue, maybe it's just going to go up a little bit here. And again, why is that bad? Well, essentially it's going to prevent us from releasing a good egg, basically. The strength of the egg in terms of survival will be lower if estrogen levels are low. One of the fertility treatments, if I was having issues getting pregnant, would be to increase estrogen levels so that the egg becomes a stronger egg, basically. Okay, so again, we see kind of this natural decrease in estrogen levels with regular training, and most certainly with overtraining, we see that. Okay, progesterone is also affected. Progesterone levels will be a little bit lower as well. Let me add those in purple. So instead of following that nice black line, progesterone levels are going to be a little bit lower here. Okay, and again, that would certainly affect fertility as it relates to the probability that that egg will implant and survive, but it's also going to have an effect on many other factors from a physiological standpoint. Again, I'm not going to necessarily test you a whole lot as it relates to the physiology of the menstrual cycle, but it is important for us to understand kind of the basics so that we can understand what the effect is when somebody has a disturbed menstrual cycle. Okay, so again, one of the major factors that we're concerned with is this decrease in estrogen that occurs with overtraining or a decrease in energy availability. And one of the factors that we see when we see a decrease in estrogen levels is we will see a decrease in the potential to store calcium. Okay, so estrogen is going to allow us to enhance calcium deposits within the bone. And so if I decrease my estrogen levels, then that will also cause a decrease in calcium storage within the bones. Now, throw on top of that this person has a low energy availability, so they're maybe not consuming enough calories, and you've kind of got a double whammy there. So you have a decrease in the calcium that you're inputting into your mouth, and also a decrease in the ability to store that calcium, which, like we said, will lead to some issues within the skeletal system. So again, I love this stuff. I'm a physiologist, so I love looking at these kind of feedback systems and how this all works. Okay, so again, this system will work on a feedback loop that's going to continue on, and there's a lot of kind of checks and balances that occur in order for us to either have the egg become fertilized or have that egg kind of be flushed out and start the process over again. This is really complicated, is really my goal here, is to have you really appreciate that this system is very, very complicated. And so, having a negative impact on our ability to have this process work can cause many issues outside of just fertility issues. Because again, if you're working with a high school female or even a college age female, they don't care about infertility. That's not an issue for them, maybe until later in life, but this can have lasting effects on them, which could lead to issues with fertility later in life. Okay. So again, as we mentioned, there's a couple different factors to consider here. Amenorrhea is the complete loss of the menstrual cycle. So again, basically what happens is my estrogen and progesterone levels are not high enough to facilitate A, the release of the egg, and B, to facilitate the growth of the endometrial lining. And so for those reasons, we're not able to complete the menstrual cycle. Okay. Again, what causes this? Certainly there can be some imbalances or some issues within within the endocrine system. But a lot of times, this is related to energy deficit. So I'm not consuming enough calories in comparison to what I'm expending. And like I said, this can lead to infertility, not only in the short term, but also in the long term as well. Okay. The reason that this issue with the menstrual cycle is so important is this is probably the easiest component of that female athlete triad for us to actually diagnose. Okay. It's very easy for females to be able to kind of track their menstrual cycle over time and look for changes within that. So again, if this particular athlete is normally having a period every 30 days and all of a sudden they skip one or they skip two, or it goes from 30 days to 40 days and then it goes from 40 days to 45 days, right? So being able to kind of track those changes gives us a great amount of information as it relates to energy deficiencies. Okay. So that amenorrhea is when I completely lose my menstrual cycle. Oligomenorrhea is when it's very irregular. So I still have some menstrual cycles, but it's just not as often as it should be. It's like 3 to 6 menstrual cycles a year for oligomenorrhea. Amenorrhea is technically classified as 0 to 2 menstrual cycles per year. And then eumenorrhea is our normal. This is what females should, want to have, is 10 to 13 menstrual cycles per year. And again, that's considered normal. So again, I've mentioned this whole concept of RED-S, or relative energy deficiency syndrome, or sometimes called relative energy deficiency in sport. Okay, so again, we've spent some time talking about menstrual function and how the lack of estrogen can lead to issues with bone health. As it relates to calcium storage. Again, if I decrease calcium storage within the bones, this is going to have a negative impact on my bone mineral density, which is going to put me at greater risk for bone breaks, and in particular, if you're working with endurance athletes, stress fractures. Okay. But what I want to point out in this particular slide is it's not just those two components of the body. This has a kind of an all-encompassing effect on an individual. Okay, so it's not just endocrine system, it's not just what's going on with our bones. It also affects many other things, including our immune function. So again, I'm more likely to get sick if I'm not fueling myself appropriately. It can have a negative impact on my metabolism. So my metabolism can slow down. It can certainly affect my growth and development, and also affect my ability to respond positively and adapt to training. So that's no good for us. And it can also be a psychological limiter for us as well. So again, feelings of burnout are very likely in somebody who is experiencing RED-S. Okay. One other thing I want to point out, this isn't just an issue for women. I went to a conference, gosh, I guess it was before the summer before COVID, and I sat in on a presentation that was all about RED-S and how we're starting to see this more commonly actually in males as well. We've known it's been an issue for females for many, many years, but now we're starting to see some of these issues in males as well. Now, certainly menstrual function isn't an issue for our male athletes. However, we do see a decrease in testosterone levels in male athletes who experience RED-S. And as a result of decreased testosterone levels, we're going to see an impact most definitely on growth and development. So these particular males are going to have a harder time adapting to exercise, seeing muscle growth and repair and recovery from our hard workouts. So again, this is not an issue just for women. We also see these issues coming about in men as well. Okay. Again, when we think about how RED-S affects not only females, but also males, one important component to kind of point out here is the ratio or the relationship between growth hormone, cortisol, and testosterone. Okay. HGH, which is human growth hormone, this is going to help us to build up. Again, growth hormone is really important during development. So if you're working with an athlete who is still growing, this is certainly of concern for them. So maybe it could stunt their growth or kind of slow down the growth process. If you're working with collegiate athletes, the issues associated with a decrease in growth hormone, even adult athletes as well, is we're not able to recover from a hard workout very quickly. Okay, so when I have a decrease in growth hormone levels, that's going to impact my ability to repair muscle mass that I might have damaged during that individual exercise bout. And basically, you might be thinking like, oh, well, I don't want to have muscle damage in my athletes. Well, yes, you do. Anytime we're sore, we've elicited some muscle damage. And the reason that's good is because growth hormone is going to help us to build that muscle back stronger than what it was before. So that's all good stuff. We want that to happen. Okay. It's okay to have a very acute decrease in growth hormone that would kind of put us right on the brink of overtraining, as long as we then give ourselves some recovery time, give us like a nice week to kind of recover and rebuild from that particular process. So in the short term, not a big deal, but if I chronically have this decrease in growth hormone, that's really going to hinder my ability to recover from hard exercise. When we think about males, another factor to keep in mind when we think about growth and development is not only testosterone, not only growth hormone, but also cortisol. And cortisol is a stress hormone. So we release cortisol when we're in stressful situations. So anytime we do exercise, that's a stressor to the body. And so we're going to release this hormone cortisol, right? And so what's important about cortisol is we need cortisol and testosterone to be in appropriate ratios. Okay, so if cortisol levels increase, we also need testosterone levels to increase. Well, we don't see increases in testosterone in athletes that experience red S. Okay, so if I give myself a hard stressor and I'm not fueling myself appropriately in order to help with that recovery process, instead of rebuilding that muscle back stronger, I'm going to really hinder my progress there. So again, if I give myself this really hard stressor, which causes cortisol to increase, I also need to fuel myself appropriately so that testosterone levels are going to also increase in order to kind of compensate for that hard workout and allow us to recover appropriately. Okay. Bone mineral density, as I mentioned, is a huge concern when we think about the red S because of the risk associated with stress fractures. Okay, so a new study, not that new anymore, 2017, but we haven't had a lot of research going on with COVID in this last recent years here. So new study in Division I cross country runners suggests that there's less risk for stress fractures if a runner is getting enough energy, vitamin D, and calcium. Okay, so this was true in both our females and our males. So when we think about energy availability, we also want to think about the quality of those calories as well. It's not good enough to just eat a bunch of Cheetos in order to fulfill our energy needs. We also need to make sure we're getting quality energy from calcium, from vitamin D, for both our males and our females. As we mentioned, with a dysfunction within the menstrual cycle, we're also going to see an issue with bone density. So basically, estrogen, again, is going to help us to store calcium within the bone. And so if I decrease my estrogen levels, I decrease calcium storage. So amenorrheic athletes have significantly more stress fractures than athletes with the regular menstrual cycle. In the long run, not only are we concerned with stress fractures, I think that I've found that that's the greatest selling point for me when I work with an athlete, whether it's a high school athlete or a college athlete, because those are immediate. Okay, osteoporosis is a decrease in bone density that might affect these females when they're 60 years old, 50 years old, something like that. That's not a strong motivator for them, but that is something to be aware of, that this can have lasting effects on them. And in the long run, they can experience this decrease in bone mineral density that can affect them later in life as well. And a lot of times that's seen as osteoporosis. So again, I don't usually use that as a selling point to them because a lot of times they're not concerned about what happens when they're 60 years old. They're concerned about what time they're going to run in this race, or looking this particular way. They can't see that far into the future. So again, I try to stick with kind of those immediate consequences, and again, hopefully that is good enough to help these females to see this change. But again, stress fracture is going to end their season, so we want to make sure we emphasize bone health is so important to them now, not just when they're 60 years old, although that is very important as well. Okay, so again, how do we treat this female athlete triad? How do we treat Red S? So the goal of our treatment for those that have been diagnosed is we want to restore regular menstrual cycle. We want to restore energy balance, and we also want to try to enhance their bone mineral density. So again, we want to just basically reverse those negative consequences that we saw with some sort of treatment. Okay, so you can use a pharmacological treatment. Really, my honest opinion about this is a lot of it has to do with a psychological component or some sort of counseling. Again, who might be involved with this? An OB/GYN might be able to help them understand the menstrual cycle issues. Certainly a sport nutritionist, I would imagine. Many athletes and many coaches don't have access to that particular type of person. Certainly coaches, parents, as I mentioned, a mental health care provider, whether that's a counselor, a psychologist, something along those lines, can also be involved. Again, menstruation is a signal that things aren't going right? So if I don't have my menstrual cycle, that's a sign that I'm doing too much or I'm not eating enough. And so, we need to address those things. So again, here's kind of what we're looking at as it relates to a timeline for these particular issues. So again, recovery of bone mineral density could take years to do. And so essentially I need to start with restoring my energy needs. Again, that can be quick. We can restore our energy balance within days or weeks. Okay, as I start to do that, that's going to help me to start recovering from some of those harder workouts. As we mentioned, the menstrual cycle can be recovered within months. Maybe it's 3 months, maybe it's 6 months, somewhere along those lines. And as I start to see those normal cyclical release of those hormones that we mentioned, in particular estrogen and progesterone levels, then it will start to have an effect on our bones. And so the bones are not as metabolically active as many of the other systems of our body. And so therefore it can actually take years in order for us to restore that bone mineral density. And unfortunately, the older this athlete gets, the harder it is for us to kind of build up that calcium storage bank. And in fact, we have seen that when athletes are over the age of, some sources say 22 years, some say 24 years, essentially all the work is done. So what I mean by that is I can store calcium in my bones like my whole life, but up until the age of 22, 24, somewhere in that range, I can continue to put money in that savings account. I can build it. Once I get to that particular age, I'm kind of maxed out in how much I can store, right? I can try to maintain what I have, but essentially it becomes really difficult for us to kind of increase that storage bank once I get to that particular age. So it's really, really important if you're working with high school athletes to emphasize that they've got to do this now, or they might have issues for the rest of their lives if they're not careful as it relates to calcium and also bone mineral density. So that's something that's super important, I think. So, I mentioned that it was really important that we restore the menstrual cycle. Well, then the next question I normally get is, okay, well, what about birth control, right? How does birth control affect some of these issues, right? So there's lots of different options when it comes to birth control. I'll kind of go through the basics of these, but essentially some of them are going to affect our hormones. Okay, so some are going to affect estrogen levels, some are going to affect progesterone levels. It just depends on what method this individual is on. There are IUDs, which is basically an implant into the uterus. Usually it can also go in the cervix. It's usually in the uterus now, but basically you can get a copper one of these and it doesn't affect hormones, it just monitors or creates an unwelcoming environment for the egg to implant. So it won't allow implantation on the uterus wall. So again, this is probably the only option where your hormones aren't influenced or your hormones aren't manipulated. Okay, most of the pills that you take, if you take a pill every single day, generally it's going to be an estrogen supplement with that. The rings, the patches, and the implants are all going to generally affect progesterone levels. So they're going to give you a high level of progesterone, which will manipulate how often you release an egg or how often you get your period. Okay, so it basically stalls you in one like section of the menstrual cycle, and it won't let you manipulate above and beyond that level, basically. Okay, so what I'm telling you is that this can sometimes give athletes kind of like this false hope, right? So this takes away the chance that you can use menstrual cycle as a predictor of overtraining and understanding, if this, is an issue for that particular person. Okay. So what if you're on the pill and so you don't have that signal? Or what if you're on one of these different birth control choices? Well, we have seen that there's no evidence that any of these birth control methods are going to be harmful or bad for bone mineral density. So that's good. Again, you're probably, whether you're at a high school or at a college, you're going to have some athletes that are using some sort of birth control. Okay? We are seeing trends in the research towards a positive relationship, but it's inconclusive. So what I'm saying is using one of these methods might even have a positive influence on someone's bone mineral density. So again, it's not great because it doesn't tell us if we are consuming enough calories. However, it's decent as it relates to the bone density thing, right? Let's see. There is a screening questionnaire that a doctor could use to kind of look for some of these other signs and symptoms of the female athlete triad. But again, if you're working with an athlete that is on a birth control pill or some sort of birth control method, it's going to be hard to kind of understand if they are suffering from this issue or not. One other kind of disorder that I kind of wanted to just mention very briefly is this concept of muscle dysmorphia. And this is almost the opposite of what we talked about when we talked about anorexia, but this is a distorted body image issue where individuals have an intense, excessive preoccupation or dissatisfaction with body size and muscularity. Okay, so again, they are viewing themselves as like weak when really they are not. They are very muscular. Okay, very prevalent in male bodybuilders and also weightlifters. So again, we're seeing more trends of this, in today's day and age in comparison to, over the past 20 years or so. So how do these various eating disorders, whether it be the female athlete triad, bulimia, the muscle dysmorphia, etc., how do these affect our health and performance? So essentially, anytime I am messing with my energy balance, I'm going to have a decrease in basal metabolic rate. Okay, so basically what that means is if I restrict my calories, my body will also restrict its need as it relates to calories. So I'm going to need less because I'm giving myself less. Okay. It can have a negative impact on exercise performance because I don't have the fuel available, particularly if I want to do anything with high intensity. This can be a huge issue for us then. Okay. Hormonal disturbances is another issue. Again, we talked in great detail about estrogen and also in some detail about testosterone as well. Dehydration and electrolyte loss can be some issues as well that we might face. Increased risk of overuse injuries, in particular stress fractures, but many other overuse injuries are available as well, and that is usually prevalent because we have this decrease in energy availability. So I have to try harder to do what I would have been able to do if I would have fueled myself appropriately. And then also a decrease in concentration because maybe my brain isn't receiving enough carbohydrates, so that can certainly affect us there. Okay. What about treatments for this? So treatment options really need to address what's going on as it relates to we don't want to just tell them like, well, you you got to be eating more. Well, that's, yeah, they know that, they get that, right? So we've got to address what's really the issue, right? So we need to understand what's going on, and what drives them to be this way. Okay, so treatment options must start, you got to backtrack a little bit. Okay, so we've got to figure out what the actual problem is, or what the reasoning is behind kind of what they're doing in order for us to start to approach this. Certainly, I would say the psychological aspects of this disorder are way more important than any type of nutritional advice you can give them. Certainly, you can involve a registered dietitian. If you don't feel comfortable giving them any advice like that, then you can certainly recommend this athlete to go see someone else. But when it comes down to it, they're going to likely confide in someone that they trust, and a lot of times that's a coach. So again, I think when we think about treatment for eating disorders and how do you handle this type of situation, there's lots of right ways to do it. But really what I think my major piece of advice I can give you after working with maybe hundreds of athletes is show them that you're invested in them. Okay, make them trust you, make yourself feel, that they can share that information with you. And B, tell them that everything that you're doing is because you care about them. Okay, and whatever you do next, that can vary, but if they know that you care about them and that's why you're doing what you're doing, then at the end of the day, you will be able to help them. They've got to want to be helped too. That's the other hard thing about this too. But again, there's lots of different ways you can help someone like this, and we've got a discussion post coming up where you can kind of brainstorm some ways in which you might help someone. But at the end of the day, you've just got to show them that you care. You've got to build rapport with them. I will tell you, I was a poster child for the female athlete triad when I was in high school. Or in college, my freshman year of college. By default, I had lost some weight just because I was running a lot more miles than what I had in high school. Total type A personality. I wanted to be the best athlete there was. I'm extremely competitive. So I was running the most miles of anybody on the team, which isn't smart if you're a freshman. And so, by default, it wasn't that I was not like eating enough. I was just eating what I had normally eaten before. Well, now if you add an extra amount of energy expenditure, well, then now you're imbalanced, right? So now I wasn't getting enough calories, and it wasn't because I had any body image issues or anything else like that. It was more about I wanted to be good, and I thought this was the only way I could be good was run a lot of miles, and the rest just kind of happened. So again, menstrual cycle gone, stress fractures. I had 3 stress fractures in my first year of college. So again, a lot of times I share these experiences with athletes. So if somebody comes to me and wants to talk about these things, like that's a common ground for me. So I can do that, and I also talk about other athletes that I've worked with, so that this person doesn't feel alone. So again, I think really the key things you want to do when you're working with someone like this is A, show them that you care, and B, show them that they're not weird. This isn't uncommon. Like, this happens, and that's okay. And I think that's really the key to helping somebody with one of these issues. Again, what are the best treatment options? They can see a registered dietitian. You can have them, get on some sort of plan where we're tracking their menstrual cycle. We're tracking what they're eating, get their parents involved if they're a high school athlete for sure. And maybe they need to see a counselor as well. So again, lots of different options for them here. Treatment is best accomplished when it's a team approach. So again, maybe there's a physician involved or a psychologist, a dietitian might be needed as well. Also athletic trainers, coaches, parents. So again, you should feel comfortable reaching out and getting help with this. So don't feel like it's just you and the athlete. We've got to think about how we can get other people involved in order to help this person. Okay. Most athletes are not going to be allowed to continue to play their sport, and that is usually a huge deal for them. Okay. So again, when we think about eating disorders, it's usually not about food. It's usually about emotional and psychological issues. Sometimes control is one of the issues that I've found to be a major concern for these athletes. So again, you got to help them to get the help that they need. Don't expect yourself to be the expert in this area, but just show them that you care and show them that you're willing to learn and figure out what you can do to help them in the end. And, that you'll do a great service to this athlete. How can we prevent these types of things? So how can we prevent eating disorders? Again, we'll talk in more detail about this in our discussion post, but wow, yeah, whose job is it to inform athletes or inform young ladies for that matter about some of these issues, and how do we do that? Is it in the educational system? Is it up to the parents? Is it up to coaches? So again, that's something that I want you to think about, and we'll kind of discuss that in our discussion posts. All right. Have a great day, and thanks for tuning in.